Let's talk about a simple 5-minute daily routine that can, and I mean this, literally save your feet. It's one of the most powerful things you can do to prevent the really serious complications of diabetes, and it all starts by just paying a little more attention to something we all tend to take for granted.
And this quote, man, it really hits home because it gets right to a scary reality of diabetes. The condition can actually damage the nerves in your feet. It's a thing called neuropathy. And what that means is you could step on something sharp, get a cut, a blister, and feel absolutely nothing.
So you can see how this happens, right? A seemingly tiny problem, like a small cut, just goes completely under the radar. Because you don't feel it, you don't treat it, and that's where the real danger starts. And believe me, it can escalate fast.
But here's the good news, and I really want this to sink in. Most of these awful complications are preventable. They are not a foregone conclusion. The key isn't some fancy, complex medical procedure. It's a simple, consistent routine you do every single day.
So let's walk through the 7 daily habits that need to become as automatic as brushing your teeth. These are your non-negotiables for healthy feet. So let's get into the first and honestly the most important one.
First up is the most critical habit of all. You have to inspect your feet every day.
Think of this as your personal early warning system. Since you can't always rely on feeling a problem, you have to see it. So, every day, you need to take a really good look at your feet. Use a mirror to check the bottoms, or hey, ask a family member to help out. You're searching for anything unusual: cuts, blisters, red spots, any swelling. And please, don't forget to check between your toes. That's a prime spot for trouble to start. And this is exactly what we're talking about. This one simple act, just taking a moment to really look at your feet, this can be the one thing that stands between you catching a problem early and it turning into a serious infection.
Okay, moving on to habit number 2, which is all about how you wash your feet.
Now, the details here are surprisingly important. You want to use lukewarm water, right? But you can't trust your feet to tell you the temperature, so you test it with your elbow, just like you would for a baby's bath. Also, try to avoid soaking your feet for a long time. That can actually soften the skin too much and make it weaker. And when you're done, pat them dry gently, no rough scrubbing. And make absolutely sure the space between your toes is completely dry. All right, habit number 3 is all about moisturizing. Seems simple, but there's a really crucial detail here that a lot of people get wrong. You absolutely want to moisturize the tops and soles of your feet to keep the skin from getting dry and cracking. But, and I cannot stress this enough, never put lotion or cream between your toes. That area needs to stay dry. Trapped moisture there is just the perfect breeding ground for a fungal infection. A simple, fragrance-free lotion or even coconut oil will do the trick. Next up, let's talk about habit number 4, taking care of your toenails the right way. Okay, look at this. There is a right way and a very, very wrong way to do this. You want to cut your toenails straight across, not in a curve. Cutting them on a curve is pretty much the #1 cause of ingrown toenails, and an ingrown nail is like an open door for infection. If you have any sharp corners after, just gently file them down. All right, we're on to habit number 5, and this one is so important we're actually giving it its own section. We're talking about your footwear. Yep, we're dedicating a whole section to this because it is that important. I want you to start thinking of your shoes not as a fashion accessory, but as essential protective gear, almost like a piece of medical equipment. The goal here is really simple: protection. You need shoes that are closed-toe, ideally made from something breathable like leather or canvas. This means avoiding open footwear like chuck balls or sandals that leave your feet exposed to cuts and scrapes. You want to look for shoes with a wide toe box so your toes aren't all squished together, good cushioning, and something adjustable like laces or Velcro. You know, those thin, flat slippers might feel nice, but they offer basically zero protection. And here are the rules that go along with the shoes. Rule number 1, and I mean this: never, ever walk barefoot, not even in your own house. Always wear clean, dry socks. And before you slip your shoes on, every single time, give them a good shake to make sure a little pebble or something hasn't gotten in there that you might not feel. Okay. Let's zoom out for a second for habit number 6, because great foot care is directly linked to how you manage your health overall. This one's fundamental. You've got to manage your blood sugar. Think of it like this. When your glucose levels are constantly high, your body's internal healing system is forced to work in slow motion.
A tiny cut that might disappear in a few days for someone else could stick around and become a dangerous, non-healing ulcer if your blood sugar isn't under control. And finally, habit number 7. This is all about eliminating a major risk factor that's completely within your control. Don't smoke. It's truly that simple. Smoking wreaks havoc on your blood vessels and chokes off the blood flow to your arms and legs, especially your feet. And less blood flow means less oxygen and fewer nutrients to heal any injuries, which just sends the risk of ulcers and amputation through the roof. So those are the 7 habits for prevention, but you also need your own internal alert system. You need to know exactly when a problem is too big to handle on your own, and you need to call a doctor immediately. Think of these as the giant flashing red flags. If you see any of these, it's a signal to stop what you're doing and get professional medical help right away. You need to burn this list into your memory. Any new wound, cut, or blister, even if there's no pain. Any sign of infection, like redness, warmth, or swelling. Any kind of discharge or a bad smell. And this one is critical. Any change in your skin color to dark blue or black. These are not wait-and-see situations. These are medical emergencies. Okay, we've covered a lot, so let's pull it all together into a super simple prevention plan you can use every day. Think of this as your daily cheat sheet. On the do side, inspect your feet daily, always wear footwear, cut your nails straight across, and report any wound immediately. And the don'ts, do not walk barefoot, don't soak your feet, don't put cream between your toes. And please, never ever wait to see if a wound will just heal on its own. Let's end on this thought. This entire routine we just went through takes, 5 minutes a day? 5 minutes. That small investment of time can protect you from complications that can take a lifetime to deal with. It's the most powerful trade-off you can possibly make for your health. So the real question is, which one of these habits are you going to start today?